All right. Hello, everyone. Welcome to the informational webinar for the American Heart Association's Strategically Focused Research Network on earlier detection and delaying progression of valvular heart disease. Congratulations to all of you guys that were invited to apply and pass in the pre-proposal stage. Just as a note, we want to let you know that this webinar is recorded. We ask that you please remain on mute during the webinar. If you have any questions, there are designated Q&A box where you can put your questions. And we have a whole host of team that will be able to assist in answering those questions. You already know we've passed the pre-proposal deadline, which was October 29, and now we are in the invited full application. The deadline for that application is on the 21st of January, and it will end at 4 p.m. Eastern Time. This is an overview of what to expect during this webinar. We will be talking about the overall purposes, award details, award requirements, peer review, FAQ, and we'll have frequently asked questions and also a Q&A questions and answer at the end of the recording. The intent of this particular initiative or network is to have a collaborative of researchers come together and have their efforts pretty much lead to an increased understanding of the earlier detection and or delayed progression of valvular heart disease. As you can see, this highlights how our networks are structured. Projects can come from all projects in the centers can come from a single institutions, or they may come from different or multiple institutions. Each center project PI or principal investigator must have the necessary research team required and infrastructure in order to be able to conduct the research that they stated in their proposed research plan. Each center application will also include 3 research projects, 2 or 3 research projects. Applicants may choose the scientific approach that they want, basic clinical or population studies. And the research must appropriately address the questions that are being posed in the projects. Each project should be individually meritorious regardless of the other projects, but all the projects must complement each other for the broader theme of the center. All projects will be scored individually, and the centers with the highest average scores across projects will be considered, will have further consideration. There will be 3 named fellows throughout the duration of the 4 years of the award. And each fellow will be there for at least 2 years or have a 2-year appointment, starting at the first year of the award. The typical structure of the fellowship is you have your first fellow within the first year, and they would be there for year 1 and 2, second fellow, year 2 and 3, third fellow, year 3 and 4. So there may be a slight overlap between fellows. Fellows must retain a 75% full-time equivalent during the time of their research project. A network collaborative will also be put together within the first year. The collaborative itself will start in the second year, but it will be put together within the first year of this award mechanism. Awardees will receive more information regarding that collaborative a little bit later. We encourage applicants or applications to have institutions that are area eligible as part of your center. And for area eligibility, you can really refer to the NIH definition that's provided on their website. I think a team member will probably put the link for you guys in the chat in case you're unfamiliar with what area eligibility looks like. Each center applies for funding and a complete unit, but each component is peer reviewed for both the science and research, as well as the training and synergistic components. The most meritorious applications and associated research projects will represent the SFRN. It's important to note that the institution may submit only one application for any SFRN funding. It is the responsibility of the institution submitting to ensure that only one proposal is submitted for the institution and to coordinate across several institutions to create a single application. Some of our requirements regarding the process. So in addition to the competencies, the center director must also exhibit the clear demonstration of commitment to the integration with the other sites or centers that will be selected. And he may also serve as a project PI, but if a center director decides to serve as a project PI, he or she needs to realize that altogether the full-time equivalent or the minimum effort for the full-time equivalent will be summed up between both roles. So the 20% requirement for center director and the 10% requirement for project PI, which comes down to 30%. The center director cannot serve in other director capacity on an active proposed network. And for this particular mechanism, we will not allow co-center directors. As previously mentioned, the award will last for 4 years, and there will be about 4.4 million allocated to each center. This includes the 10% indirect costs. The direct cost for this award will be discussed a little bit later, but 4 million for the direct cost and 400 million maximum for the indirect cost, which will be the 10%. The network will be comprised of at least 3 centers. Centers will be reviewed through a rigorous 2-phase peer review process. More peer review information will be provided later on during the presentation. It's also important that the Heart Association awards that the center and institution pays the centers directly. So centers are responsible for managing and maintaining all subcontracts and paying the PIs not housed at the center institution. This is a sample of the budget as discussed a little bit earlier. So for the projects, you have about 3.2 million that's allocated for the 3 years of the project and about 450 to cover the fellows with a maximum of 75 per year for each fellow. This includes fringe and benefits, of course. The one center director will only have a maximum of 50,000 salary at a cap. This includes fringe and benefits for the 20% effort. And a total of 40,000 will be allocated to cover the travel costs of personnel for the center. This includes all kinds of personnel, the center directors, the required personnel, at least the center directors, the PIs, and the fellows. and any other person of importance that you may need to have travel for purposes. Please keep in mind that the next annual meeting for the SFRN will be in Denver, Colorado on September 2026. More details will be provided later on. There's 30,000 also that will be allocated that each institution should or center should allocate for a face-to-face scientific meeting that will be hosted. As I mentioned earlier, 10% maximum indirect cost is what is allocated for each award. So it will be a maximum of 400,000 for this particular award. We talked about this a little bit earlier, but again, all payments will go to the institution, and the institution, or at least the center institution, and that institution is responsible for paying projects or any other parties that are not focused or that are not at their particular site. This includes your subcontractors. And not to repeat myself regarding the indirect costs, but we're, again, just a maximum of 10% for the indirect costs. We require that if you have any subcontracts, that all documents be provided to the AHA. So you will have particular deliverables to submit on those executed subcontracts. It is imperative that all key personnel in the application process have an AHA membership or Heart Association membership. So the center directors and the principal investigator must have a Heart Association membership. Please do not wait till the last minute to try to renew your membership or have a membership, as it can take quite a few days for that process to go through. So we really ask that you start thinking about membership now if you do not yet have one. Collaborative investigators or co-PIs, for example, are also encouraged to have membership, but that is not a requirement. When you are renewing membership, we'll put information in the chat, but you can go to professional.heart.org and go to our partners page, and that's where you will find the membership information link. For the review process, as you can see, we mentioned earlier, we'll have two phases as part of this particular process. So once your application is submitted, it will go through phase one with a review with scientists reviewing kind of the submitted application, and then we'll have a phase two for a reverse site visit presentation for those selected. Some of the essentials, part of the late summary, AHA will assess potential applications based on this late summary. So application will need to be able to really describe their proposed research in non-scientist terms. This potentially impact the assessment and will be based primarily for non-scientists. The lay summary is a required component of each application, and the Heart Association takes it seriously. We have a lot of stakeholders that are not scientists, and they participate in the peer review process as well as the oversight. So it is important that lay summaries are written in a manner where the stakeholders can fully comprehend the scope and goals of the project. It is important that your list summary also relays how the proposal supports the goals of the Heart or the mission of the Heart Association. Other peer review criteria that will be looked at, you have your approach. The projects are reviewed separately from the centers, and this occurs in phase 1 of the peer review process. We'll be looking at the synergy between the projects. How does this one project pretty much enhances the center and the additional science of the other projects? And how does maybe that one project allows the center and additional science of projects to outperform where it has to be a standalone project? Only projects that demonstrate synergy will move to phase 2 of the peer review process. Now, some of these peer review criteria are listed in the RFA, or in the request for proposal. So we ask that you take a look at that if you haven't yet. It is important to note that the center is reviewed based on the criteria listed here. You'll note that the science and research projects are not listed because the science and the science projects are reviewed separately during the phase 1. The center is reviewed as the cohesive unit that binds all the projects together. The center is reviewed primarily during phase 2, during the reverse site visit that was mentioned earlier. You can see the criteria are not weighed, but rather represent all criteria that are used to evaluate the center. Major components of the center to highlight are synergy and collaboration. It will be important for each center director to give examples of synergy and collaboration in their application. Looking at the timeline again, we've already passed the pre-proposal. We are actually in the full invited application phase, which we have the deadline on January 21. Then we will have phase 1 and phase 2 review between February and March 2026, with award notification in around March. And all these awards will be starting April of 2026. The 2 phases of peer review will be conducted separately for approximately 3 weeks apart from each other. Center's team will not present for phase 1 reviews, but will be required to participate in phase 2. Applicant teams should be prepared to be available for a video teleconference for phase 2 review around March. As we're looking at the webinar today, we will also have a demo for Proposal Central next month. So that information is on our website. So on January 8th, we'll have a demo to help applicants that may have trouble with Proposal Central. One of our team members will go through what that looks like. So feel free to join that webinar. Information for future webinars and full proposal can be found on our website, again, professionalheart.org, and go to research programs and AHA opportunities, looking specifically for this SFRN on valvular heart disease, and you should be able to find more information. We will also have a live Q&A as shown on January 15 and January 16. For those of you that may have questions that were not answered either through the RFP or through the various webinars that we're having. Some of our frequently asked questions. This first question is asking the minimum % effort for an applicant And it is required for if it's required for each role, even if one person is applying for multiple roles. Yes. As we use the example of the center director, if we have a center director, for example, that chooses to be also a project PI, they will have to do the minimum % effort for both roles. So anyone applying for multiple roles are required to fulfill the requirement for those roles. Regarding call center directors, we do not allow call center directors on this particular mechanism. However, a maximum of one co-PI is allowed per project. So if a PI decides to have a co-PI, they can have a maximum of one co-PI per project. However, the named PI is responsible for fulfilling the required % effort. So if a PI has 10% effort, the named PI has to fulfill that 10% regardless of his co-PI, his or her co-PI. There are no restrictions concerning restrictions. There are no restrictions if an institution has been awarded in a previous network. The Heart Association will review for project overlaps. An individual cannot be on a center director on more than one active network. For international collaborators, those are accepted as co-investigators or co-PIs, but not as the main, not for a center director roles or PI role or or fellow role, for example. A department head letter is required, or a letter from your institution will be required. So center director and project PI applications will have to provide an official institutional support and approval of the proposed submission. During the approval of the proposed submission, only one department head letter is needed per application. Letters of support are required for project PIs being added to the center application, as well as any third-party personnel for the center and project applications. And those must come from sponsoring institution and qualified individual who can attest to the expertise of the leadership and leadership potential of the applicants. So for example, if you have a letter from a board chair or president or your dean or provost. Additional letter of support beyond those required for third-party personnel are not permitted for either the center or project PI application. The centers that perform the best have historically been awarded, and those are where the best team have been assembled, as we talked about synergy before. So centers in previous networks both have entire teams from a single institution, and some of them have teams from multiple sites. As we mentioned, this presentation is recorded and will be posted on our website in the coming days. The named fellow, again, should have a 75% effort minimum, which may be allocated between the center and the project as appropriate. Their primary salary and fringe benefits should be budgeted within the center. If additional funds are needed to supplement their salary or fringe, you may allocate those within the project application for individual fellows and reflect their additional efforts in that particular project budget. With that, we'll go to our Q&A, or questions and answers. We will read through maybe some of the questions that have come through. If you have additional questions beyond this particular webinar, please email strategicawards@heart.org. Thank you for your time. I will go to the team to see if we have questions that we can read out loud? Okay, let me look at the chat. So we have a question. No, this was required in the instructions for the center administrative structure document. We don't understand how much is required for this, and should budget be designated to an independent evaluator. It looks like this is a follow-up question to another question. Maybe I need to read what the previous question was. I will read some of the questions that were already answered before going to those ones. Again, the first question was regarding recording, access to recording. And as we've mentioned, it will be posted on our webpage. So if you want to access professional.heart.org and go to the research programs page, looking at the funding opportunities and looking particularly for this SFRN site on valvular heart disease, then you should be able to access all the webinar information and recording. The other question was regarding area eligibility, whether it can be a collaborator on one or more projects, or do they need to lead one of the 3 projects? And as we've answered, there was no mandate, or there is no mandate for area eligible institution included in the overall center. So we encourage it, but there's no mandate for it. Another question was regarding the applications. So our center application has 3 projects, 1 basic, 1 clinical, and 1 population. Is this allowable, or should it be all 3 projects were in the same category? And the answer to that is applicants may choose the scientific approach. We do not prescribe it, but it has to fall at least within one of those categories: basic, clinical, translational, populational health studies. That's most appropriately address at least your research proposal or the research question. Other questions: do you expect the center to have an independent evaluator with a full evaluation plan? Or can the evaluator be someone that is internal at the lead institution for center administrative structure? So regarding that particular question, the center structure document are provided in on our website, and for the administrative structure, we also describe the coordination and integration of activities, lines of accountability regarding management and oversight for use of funds, and evaluation of program. So again, we'll refer you to the documents that we have available. If anyone else on the team, I don't know if Nicole or Heather, if you guys have anything you want to add to that particular question. All right. Is there a required effort for training directors, and is that included in the $50K for the center director? So training directors was not mentioned, so it's not a required role for this application and not an option to be added to the center application. So there will be no required salary or range for that particular role. The center execute all subcontracts. Each project equals 1 subcontract of the center. What about subcontracts specific to a particular project? Is that subcontract also executed from the center, or would that be executed from the project? It is upon the PI to manage the subcontracts for their individual projects. Same for the center award. If the center and projects are the same or at the same institution, the center can work with individual projects to execute the subcontract. This is flexible based on how the center director and project PIs manage any subcontracts. AHA will only need the subcontracts once they have been executed. Will recruited fellows be allowed to have effort on the individual research projects on top of the already required 75% effort from the central portion? The named fellow again should have only a minimum of 75% effort, which may be allocated between the center and the project as needed. Their primary salary and fringes should be budgeted within the center. If additional funds are needed to supplement their salary, then you could budget that within the project application. And you will need to reflect any additional effort within that project budget. A follow-up question: for each project, there is 2 PI max, but in some aspect, we need extra help from biostatistician or informatician. How could we include those collaborators? So third-party personnel as collaborative investigator, consultant, and other professionals can be added throughout the process. So you can definitely include them as part of your application process. We propose, another question is, we propose 3 projects from 2 centers, from one center and one from the other. Since we don't have 3 centers, does this mean we are not eligible? So I think maybe there was confusion there. There's only 1 center that's required per institution. So the AHA will select 3 centers based off of the pool of application, and those centers will be 3 awardees of the AHA, but only 1 center application should be submitted per institution. And that center can have 2 or 3 projects. In the past, SFRNs, we have been allowed to have international fellows. In the new instructions, it appears more strict eligibility criteria have been implemented. It's flexible if training will take place internationally. Our center has 3 international sites. Well, this is only applicable if the fellows that you have the required visa. We have a list of requirements for visa on our webpage that you can look at, but they need to have the required visa eligibility in order to be listed as a fellow at your center. Is the travel budget fixed at no more than the amount indicated? Is that inclusive of project-specific travels? The travel costs in the budget illustration we didn't set are used to support travel to semi-annual meetings to the network. Other needed travel expenses can be included within each proposed budget upon notice of award. There is a required project vision document, 8-page, and it is listed as required for both center and project documents. Are these the same document? Yes, that's the center vision and synergy document, which is 8 pages long, and it's only one upload, and it has to be with it as a PDF. You should have the same document for the center and its project. Is it permissible to change the PI of a project from what was originally listed on the LOI? The project will remain the same with the same scope. However, we may decide to change personnel roles slightly. Please email strategicawards@heart.org for that particular request if you have changes in leadership or PI, and we can provide you more information offline regarding that. Is it permissible to change the training director from what was listed on the LOI? Again, that is not a role that's required. So I mean, I'm not sure if this person meant center director or if they meant training director. Training director is not a required role in the system, in our system. So, but again, email strategic awards at heart.org and with the requested change, and we can get back to you offline. So going back to the question that was posed earlier regarding the instruction for the center administrative structure document, we just don't understand how much is required for this and how should we designate our budget to an independent evaluator. So information was provided in there as far as like documents for the center, down to the bottom section of the research network section. There is no required budget for the center administrative structure or for an independent evaluator. So this particular question doesn't seem to apply to our rules or policies regarding our structures. Can you comment on the Oversight Advisory Committee or OAC? How many members? Is it external? The Oversight Advisory Committee is comprised of Heart Association volunteers that are focused in this area, and they will help kind of oversee and ensure the success of the network. The number of members varies per network, but typically we have about 9 to 12 members. Can you repeat the allocation for the fellow support? Is it exceeds the 75K per fellow? No. So it is 75% effort, which may be allocated between center and project as appropriate. So yes, $75,000 per year for each fellow. That includes the fringes. If additional funds needs to be to supplement the salary of the fellow, that can be allocated within the project application, and you also have to put in the additional effort within that project budget. Do the co-investigators' documents for all three individuals' projects also need to be listed in the center level documents? Each project application is separate from the center application and will be reviewed separately. If there are a certain co-investigators that are working on a specific project, please add them to that project applications on the third-party personnel. Third-party personnel added to the individual project applications do not need to be added to the center application unless they will have a role within the center application. The center will be the one to upload all the letters from the PIs of each project, plus the department head letter, the area letter, and all letters from third-party personnel. Is this correct? Will the projects themselves also need to upload the same letters or different letters? The list of required documents for the center and projects can be found on the SFRN drop-down tab list. So again, we refer you back to our website on the professional.heart.org to look at those particular details and look specifically for application resources on that website, on our professional.heart website. Look at application research resources and required applications documents to find the information for each. There is quite a vast resource, so we really suggest that you go there to find the information you're looking for. Can you explain more about center collaboration on the 5 pages? Do we talk about collaboration between the PIs of the center? Is it to avoid redundancy with center vision and synergy? Again, we refer you back to this is a competitive application process, so we refer you back to our rules on the website to look at what we're requiring. You can look back at some of the information provided on this particular webinar. Do all project PIs have to agree to participate on the center grant? Do all project PIs have to agree to participate on the center grant and receive in the automated email when you link a project in Proposal Central? And then we'll add user with edit right. Is the email they receive automated as soon as the project is linked? Okay, hopefully that. Yes, the center director will initiate the project applications and then link the project PI, add the project PI. Each project PI will have their own login in Proposal Central, so they need to create an account. Each project PI will have to create an account in Proposal Central. And their project will be linked to the center application. The project PI can add the center director to their project application with view or edit permissions. The PI should receive an email once the center director initiates their PI application with an automated email. But if they didn't receive an email, the PI can log in and access the proposal under the Proposal tab in Proposal Central. So someone wanted to clarify if they slightly reduce the amount allocated for research projects, can the center use those funds to budget for administrative help? The project can budget for administrative help for personnel. Given the length of the project, 4 years, is it possible that we may not yet know the name of a fellow for the year 3 and 4? Do we have to have the names of all postdoctoral fellow at the time of the application? No, it is okay to submit the fellow in the budget subject as, to be determined or to be announced fellow 1, etc. If you do not know yet the fellows at this time, you can budget for them appropriately at that point, but you do not have to have the specific names, especially for year 3 and 4 of those fellows at this moment. Are all projects in each center reviewed by the same reviewers or by different ones? Or is that not possible to say? That may depend on the topic, or may that depend on the topic of the project. Reviewers will be assigned to the applications based on the reviewer's expertise. If their expertise overlaps to all projects, they may be assigned to each application. Besides the center vision and synergy pages, are there any other sections that will be exact same and thus uploaded 3 to 4 times? The center and project application are seen as separate applications that are linked. However, to ensure the peer reviewers assigned to the individual projects have access to the center vision and synergy document, it should be the same document uploaded to each center and project applications that are linked. There is a required department head letter for each project as well as the center. Should these be from the department heads of the 3 project PIs, and the center level 1 is the department head at the center director? Meaning, is this like 4 different department head letters? The department head letter for each project should be from that project PI department chair. Same for the center. The letter should be from the center director's department chair. So if those are different, then of course that will mean you will have different department head letters. Could you speak to the evaluation process? Is it a central committee reviewing the grants? And will there be performance of the individual projects be averaged to come to a final score? Number 2, can the fellow hold faculty appointment if they are conducting some amount of training period, as in K awardees, for example? Number 3, can you speak to the post-award project that is meant to happen across all 3 centers. So in response to question number 2 regarding the fellow cannot hold a K award, and it will not make them eligible to be a SFRN fellow. So the only exception that allows a named postdoctoral fellow in the SFRN to have an appointment such as instructor is to allow the MD fellow to see patient, like for example, at 20% of the time. Otherwise, fellows cannot hold a faculty staff appointment. Regarding question 1, the evaluation process, review committee of the grant and performance, we can go back a little bit on the slide. I think we discussed that earlier on. So regarding the synergy of these projects, so the score, each individual applications will be scored, and there will be a summary score between all those project applications to kind of have a summary score. So I'm not sure if that answers that question, but yes, it will be a final score based off of the individual score that each of the projects received. Concerning the question number 3, can you speak to the post-award project, what is meant? So more details will be provided to the awardees. Once we have awardees on the 3 centers selected, I imagine you're talking about the collaborative work with the 1.8 assigned million. So yes, the collaborative effort will be discussed within that first year and will start in the second year of the award. But more details will be provided to the selected centers. Oh. So we have a response also from Tammy. So there is one committee that will review all the projects in phase 1. The project score will be averaged to determine those that will move forward to phase 2 in response to question 1 regarding the evaluation process. And Carrie's answer to question 2. Yes, so we talked about the collaborative project. Now, question, there is a page describing requirements for a training director here, so this was confusing. We will take this out. Okay, so again, for this particular RFP, a training director wasn't required. So if you may see training directors on previous SFRN related pages, but for this particular RFP, if you go through the RFP, that was not a role, that is not a role that was required. At this stage, there is only one submission from the center director, right? If selected to phase 2, then every PI must submit its own project. No, this process requires like center director and project PI's application. So if you've been invited for full application, it will require a center application linked to those 2 or 3 project PI's applications. So, but only one submission should come from each center or each institution. So once as we've explained, once those applications go through phase 2, if they're invited based on their score to do a phase 1, if they're invited to do a phase 2, then those will be the reverse site visit. So all applicants, as you're submitting, should be preparing to do a reverse site visit. We will be hosting again, as we mentioned earlier, Proposal Central demo on January 8th, Thursday, January 8th at 11 a.m. Central Time, so 12 p.m. Eastern Time. Do all subcontracts need to be executed at the time of submission for phase 1 review? So no, all subcontracts do not have to be executed at this time or during the application until you've been funded or selected for funding. We understand that the process can take time, so there will be allocated time for that, but it does not have to happen right now throughout this application process. Once you do have, if you are selected, once you do have executed subcontracts, then you can submit it in our post-award mechanism. Are there any guidelines, restrictions by which the fellows should be distributed across projects and center sites? For center with 3 sites, is it expected that each site will house one fellow at a different time throughout the funded period? The center is free to employ fellows in the ways that best facilitate the team. There is no requirement for there to be fellow at each project. In fact, ideally, the fellow will receive cross-discipline training across more than one project. For the project PI letter of support required document, does it matter? Does it mean the letter from the project PI? Let me repeat that. For the project PI letter of support required document, does it mean the letter of support from other project PIs? Not really. The letter of support are required for project PIs to be added to the center application, as well as any third-party personnel and project application. It must come from either sponsoring institution or a qualified individual who can attest to the applicant's expertise and leadership potential. Can you describe phase 2 a little bit more? Will it involve structure center presentation, or will it be mostly Q&A? If your center application is chosen to move forward, the center director will be notified with instructions and logistics. The team will be asked to provide a PowerPoint center and a project overview addressing specific areas, and followed with Q&A from the committee members. The instructions indicate that the project PI letter of support should come from the individual project PIs, not from an additional qualified individual project PIs. A letter of support from each project PI, I guess this is a quote from the RFP, a letter of support from each project PI must be provided to their director for his her application, and should include brief overview of the project PI's qualification, focus on the experience. So yes, the letter of support should come from the project PI for the center director application. So the project PIs are providing those letters to the center director application, and should highlight the PI's qualification. These letters may also be co-signed by the sponsoring institution and further validate the applicant's expertise. The third-party personnel that is uploaded at the center application, should this include all third-party personnel from all the projects? So third-party personnel can be added to each application. So as the project PI does his or her application, they can have their third-party personnel. And for the center application, the center director will have the third-party personnel, which includes the project PIs. If someone is working on the project and not on the center, they should be added solely on the project. For Wednesday, January 21, is this for center application only, right? It's for all applications that are due on this date. So again, there isn't like a separate application for center or project. This is a combined application. The center director will set the application, which includes linked project PI's application. So it should be one submission for all of those. What is going over the demo for January 8th, just how to use Proposal Central. Yes, so we'll be doing a step-by-step instruction on how to complete the center and project application. It sounds like we had a lot of questions regarding that, or there was confusion. So the demo can definitely be helpful with that process. And there will be also question and answers, to answer specific questions for those of you that may be stuck in the process, in the application process. That webinar demo will also be recorded and posted on our webpage. You mentioned there cannot be two center directors for two separate applications from one institution. Can there be two project PI separate applications from the same institution? So each project will have its own PI and application. There shouldn't be separate application for the same project. Any additional personnel on the project should be included on the project application. So I'm not sure if that answered the question. I see that Carrie also answered there can be two project PIs on the same institution within one center. All right, I do not know if I've answered. I don't see any more questions in the answered box, but it looks like we have some questions still that are open. For the information requested about training grants for each institution involved in the center, is this only for training grants that are related to the center research area? I assume we don't need to include information on training grants for different topics such as cancer. So when you're talking about training grants, I'm not sure, are you talking about a training, like a training director, if involving center? Let me read that. Information requested about the training grants for each institution involving the center. Is this for only training grants that are related to the research area? I assume we don't need to include information, training grants for different topics such as cancer, Alzheimer. That question is a little confusing for me when I'm not sure if somebody on the team has an answer for that, but if you're talking about the fellows, fellows can do projects across that can be included in the different discipline with the projects that are submitted for that particular center. So again, we don't have a training director specifically for this particular mechanism or application process. So the training grants that you're talking about, I'm not sure if I fully understand that question. If somebody else on the panel understands what is being asked, please feel free to come live and answer that.
Amanda, yeah, I was just going to say I'm not sure if they're referring to the current postdoc training program that they have to submit as part of the center application. Okay. But if they want to email us directly at Strategic Awards, maybe we can have a conversation more in detail about what they're inquiring.
Okay, yes, sounds good. Thank you, Heather. Yes, so please email strategicawards@heart.org so that we can maybe parse out what you're specifically asking. Current postdoctoral training program provide information on current training programs and training grants within the primary institution, affiliated institution relative to the research being proposed, if appropriate. Qualification and characteristics of current mentors, including current trainees, and how their ongoing progress is tracked and guided via an individual development plan.
Yeah, so Amanda, this is the information from our webpage on required documents. Yeah, so yeah, if you're submitting information about your current postdoctoral training program, this is just guidance that you can include within that document. There's no page limit on that document, but it would be most beneficial to provide what you're currently doing for your training program and training grants. So, like I said, if you want to have more of an in-depth conversation about this, please reach out to us via email and we can schedule a call.
All right. Thank you, Heather. Are letters of support needed for project co-PIs as well? And for third-party personnel in each of the center, do these letters need to need a department or person attestation ability? I think that Alice, sorry, I'm having a hard time reading that question. Do these letters also need?
Amanda?
Yeah, go ahead,
Carrie. This is Carrie. I think I answered a question in writing that hasn't been read out loud. That's okay. I think several of us were answering questions at the same time. So I'll just go ahead and say it real quick. Okay. It was the question about, is it permissible to have industry collaborations as part of the project? So I answered it this way, but whoever asked the question can contact us after the webinar for more information if needed. But the AHA does not fund for-profit organizations. So if you're proposing a subcontract with, say, a consultant who happens to be in industry or who happens to be an employee of a for-profit company, we will take that under advisement. It is not specifically prohibited in writing within the RFP. So, for example, a subcontract to cover a percentage of time for a consultant's work, that's not specifically prohibited just because they are working in industry. And I hope that answers. And sorry to interrupt, Amanda. I just wanted to make sure we got that one addressed.
No, thank you, Carrie. So we have a lot of questions. I know we are at time. I'm okay to continue for recording purposes, but so quickly we will go through some of these questions because it looked like we have a lot more questions. So I'll just read some of that real quick. If a center and two projects are located at the same institution and department, and thus the department chair is the same person overall, he will need to provide 3 support letters. Yes, so that's correct. As we said, each individual key personnel need to have their support letter. For each project portal, nor the center portal, there is also a required project PI letter of support. I think, again, that goes back to the question that was asked earlier. So each individual key personnel do need a project letter of support from their institution. I am a center director on the project and the project PI. Should I ask my department chair for a project PI letter of support? Yes, you can upload the same letter for both center and project. So we answered the training, postdoctoral training live. Are there letter of support needed for project co-PIs as well in each project or in the center? These letters also need department and other person attestation of ability. So that information will be provided in our third-party study members information page. So we will refer you back to our professional.heart.org to look at that information. Excuse me. OPIs will require biosketch. Excuse me. And letter of support. If added to the application, they will require this information. If you add someone to both the center and the project, you will need to upload this information for both. There is a required document for current postdoctoral training plan listed. Should this information be included about all existing training grants or only relevant programs? It should be only for the relevant programs that are applicable. Again, concerning that postdoctoral training plan, if you have specific questions, please email strategicawards@heart.org. For publication section, are there publications from the different PIs? Up to 3 publications may be uploaded for each project PI application, no page limit on the publication upload. And each should be uploaded as a separate document. The publication should be relevant to the research being proposed. If two co-PIs have the same department head, would they need to upload two department head letters?
Amanda,
Yes.
Can I?
Yes.
So the department head letter is only required for each application, one letter for each application. So not for separate third-party personnel. For each third-party personnel, you need a bio sketch and you need a letter of support. But for each project application and the center application, you only need one department head letter. So I hope that helps clarify.
Yes, thank you, Heather. And I wonder if they are confusing the letter of support with the department head letter when they are mentioning that. So as Heather mentioned, if you're talking about letter of support from your institution or from a qualified individual, then yes, each of those roles will need to have their individual letter. But as Heather mentioned, only one department head letter is needed for the center application. And you can use it in both. Thank you. Okay, we have a few more questions. How does the center director and PI, how does the center director and PI to explain the 30% effort that will be needed from him? So, I mean, I think that in each of the role, when you're doing your budget, you will have to put that particular percent effort. And so there is a minimum required effort. A person applying for both center director must agree to the minimum percent effort for each of those roles. If the person's institution will not allow this person to meet this requirement, then the person is ineligible to apply for both roles. But I'm not sure what you mean when you say how would they need to explain it. I think whenever you're processing your application, you should be able to determine whether you'll be able to do the 20% for the center director and the 10% for the project PI role. On the Proposal Central, I don't see a spot to upload the 17-page research plan. Where will we upload this document? You should be able to upload it in the upload attachment section if you don't see it in one of the other sections. But yes, there should be a tab in Proposal Central that says upload attachments, and you will just need to look for the research plan one. Again, we'll go through a demo and some of this will be discussed. But if you're still not seeing it, please email strategicawards@heart.org and we'll be able to address it if it's the issue with Proposal Central. So there was a clarification. The center director has to get one department head letter, then each project PI has to get one department head letter. I understand that the department head letter is not the letter of support. Correct. Okay. All right. One more question came through. Understood. I don't see it in the uploads, so I will email the address. Okay. Thank you. So sounds like there's issues with uploading in Proposal Central. Final question that I'm seeing, does the 50,000 limit, oh, that disappeared. Does the 50,000 limit for center director salary include fringe? The salary should include the fringes for it's a maximum of $50,000 that includes fringe. Anybody can correct me if I got that wrong, but it's a maximum of $50,000 and that does include fringes.
Actually, Amanda, for the center director, it's 50,000 for salary and up to 12.5 a year for a total of 250 over the life of the award, which is what is in the RFP.
Okay. Thank you, Nicole, for that correction.
Yeah.
All right. Are there any other questions I've missed? So the other question is pertaining to the project attachment. Please email strategicawards@heart.org. It sounds like there might be some issues with Proposal Central. We will address that. But there was one final question. There is only one page overview of projects attachment. And yes, that is correct.
I'll point out one thing. Current required documents for each application for the center and the project. So if you're looking for a specific upload that may not be in that application, it may not be required for that specific one. So I would just refer to what is in Proposal Central, as it should correspond to our required documents page on the website. But if you're having any issues with Proposal Central or you're not finding something, feel free to email us.
Thank you, Heather. I do not see any other questions. Are there any questions that I may have missed to read out loud?
I don't think so. I think you're good.
All right. Well, thank you all for staying with us past the time. And again, as we mentioned before, this webinar was recorded and will be posted on our website. The team has posted various links and answer to questions in the chat. So if you want to save the chat, then make sure to access that link. If you have further questions, email strategicawards@heart.org, and we will be able to address any further questions that you may have. But we will see you at the next webinar on January 8th for the Proposal Central demo. Thank you for joining us today.